Hey everyone, welcome to my channel, Root Yoga Therapy. I'm your certified yoga therapist, Jasmine, and we're here at week 20 of our pregnancy series. This is obviously an exciting time because we have finally hit the halfway mark of our pregnancy with only 20 more weeks to go. And being that this is the halfway point, I thought it would be really good to introduce some core exercises that are safe to do till the end of pregnancy. I know that there's a lot of mixed information out there about core strength and what we can do and what we can't do. And one thing that we want to try and avoid is that ab separation. So what can we do to keep our core strong, to keep our spine healthy, but yet not tear or separate the muscles? Well, join me on your mat because this short practice is going to help you get strong in your core, prepare for labor and delivery, and reduce any kind of back pain that you might feel as your belly grows. Stick with me and meet me on your mat. Great, welcome back. So we're going to start with some really basic breathing that's going to help activate our core and help us develop this relationship with this part of the body. Now, some of you might have worked out right before pregnancy. Some of you may be working out very actively during pregnancy. Some of you might just be like kind of easing into the workout thing while pregnant. So wherever you are and whatever level you are, breathing is always something that's very safe to do, and it's a great way to start stimulating your abdominal muscle. So find a comfortable seated position. I'm going to show a profile view of this because I want you to see the expansion and contraction of my belly, and you'll be able to feel it because we'll have our hands right on the belly. So I'm just going to use a block to sit on. And if this is not comfortable for you, you can sit cross-legged, that's fine. I always find that sitting kind of in this position, almost like a kneeling position, gives me a little more space here, and I feel a little more connected in terms of my breathing when I'm focusing on that core. So sitting on a block just to elevate my hips, release any tension around my knees, any deep stretching around my quads, and I really like this stretch too into my ankles and feet. So one hand on the belly and one hand right around the diaphragm. So you can kind of frame the belly this way. If this is not comfortable, just have hands on both sides of the belly. That can work too. I like one hand on the diaphragm, one hand on low belly because I can feel the whole space kind of expand and contract. And I can really visualize what my muscles are doing to create the movement. So I always find it's nice to just start with the eyes closed. And just kind of noticing how you breathe. Typically, most of us breathe very passively. There's not much energy or activity when we breathe because it's such an unconscious thing that we do. But as we're starting to strengthen our core and focusing on breath as a tool for that, conscious breathing and active breathing is going to be key. So just starting off here and just kind of noticing what you're experiencing. Noticing where your energy is. How you feel about this part of your body. Sometimes as our belly grows or we stop kind of engaging our core, we feel a little disconnected. So if that's showing up, that's something to notice. Good. We're going to start to move into a more active breath. So I want you to feel your belly and ribs kind of get bigger and expand on that inhalation. And then watch my belly as I exhale. The belly draws in. It's a pretty big movement. My belly gets nice and small. It's almost like you almost can't tell that I'm pregnant. So as you inhale, really letting it all hang out, find that nice big stretch, right? The bigger the stretch, the more we'll be able to contract. Exhale, draw it in, squeezing the air out. Now, it's okay if your belly's not moving as much as mine. Don't forget it. I've been doing this for many, many years. So just kind of notice, you just want to feel that contraction. So just starting to build that relationship. Inhale. Exhale, squeeze. Try not to round in the upper back, keeping the chest tall. Inhale, releasing the belly, finding that big space. Exhale, squeeze. Really nice. Inhale. Exhale, squeeze. Last one. Inhale. Now action is kind of in and up. So think about the belly button drawing in and then up towards the heart. Good. Let's try one more like that together. Inhale. Think about your belly button drawing inward and then upward. Really nice. Good. We're going to come into a hands and knees position. Please have a prop. If you don't have a block, use a pillow. That's a great option here. We're going to place that block or pillow in between the inner upper thighs. And I'm just going to move this guy out of the way. Hands are going to come underneath your shoulders. I want you to feel a release here. So as we go into a cow pose, you're going to drop the belly. So that's an inhale, right? Dropping the belly, getting nice and big, chest lifts. As you exhale, round the spine, squeezing the block. So your navel's drawing in and up. And you find that activation again. Inhaling, coming into that cow. Exhale, squeeze the block, draw the belly in and up. And you might even find that sense of like Kegels working here. Good. Again, inhale, dropping the belly, lifting the heart. Get nice and big. Exhale, find that contraction. One more. Inhale. Exhale, contract. Squeeze the block. Really nice. Good. Finding that neutral position. We're going to release the block. We're going to come into a side plank. So you go ahead and extend your right leg back. Spin the outside edge of the foot down. And then pause here. Right hand's going to come to right hip. Right arm's going to move up overhead. If this is too much, you can always keep the right hand on the right hip. Good. And you're just engaging your obliques. Now this is going to take a little bit of balance, so you might want to be near a wall. And if you are, you can use that right hand to help kind of support you. Otherwise, if you're feeling like your balance is pretty strong, we're going to inhale, float the right foot up. Exhale, squeeze, carefully lowering it down. Inhale. Exhale. 3 more. Inhale. Exhale. Last 2. And last 1. Nice job. Wrap the right hip down, lower the right hand down. We're going to stay on this side doing a different variation of a side plank. So I like to have a blanket on my mat just because that kind of helps support my knees. And we're going to be knees together. You're going to kind of hinge forward. And this is a modified variation. Some of you, like I said, if you've been working out a lot, this is something that's very familiar. You can stagger the feet. You can stack the feet. This is much stronger. Otherwise, have the knees down. And this is how I'll show it today. So I'm going to walk my left hand slightly forward so I can get that nice angle. Open up here. We're just going to stabilize for 3 breaths. Last 1. Good. Releasing the right hand down and coming back onto all 4s. Really nice. We're going to switch sides. So This time the left leg is going to step back. You're going to spin the left heel down and be in this side plank variation with the right knee down. Okay, left hand to left hip, maybe on a wall if you're using that as a little bit of support. You can also back yourself up all the way towards the wall so your whole entire back is aligned to that wall if you're feeling a little unbalanced today. And then as you inhale, start to engage the back leg, floating the foot off the mat. Exhale, belly draws in, lower the foot down and tap. Inhale, lift. Exhale, lower. Inhale, lift. Exhale, lower. Nice, 2 more. Last one. Good job. Releasing the left hand down, left hip down. Good. Finding that angled side plank, so knees together, kind of shifting forward, shoulder over wrist, and then holding here 3 breaths. So obliques here are really working. Really nice. Left hand down and then back into our hands and knees position. So it doesn't matter what side of the mat you're facing. We're going to slowly come down onto our forearms. So coming onto the forearms, giving those wrists a little bit of a break. You can circle the wrists. You can kind of press down on the tops of the hand to give them a little stretch. And then we'll find our way back onto our forearms. So I like to practice a lot with my forearms shoulders distance apart. You're welcome to interlace the hand as well. And you're going to shift the body forward. Knees are going to drop back a little bit. So you're in this modified plank on the forearms. Good. And all you're going to do is shift forward and backwards. So inhaling to come forward. Exhale, press back. Inhale, forward. Exhale, press back. Imagine that you're drinking some kind of drink that's in between your thumbs here. Inhale, taking a sip. Exhale, press it back. 2 more. Inhale. Exhale. Last one. Inhale. Exhale. Really nice. Start to walk the knees back in, sinking the hips towards the heels, giving the belly a little rest here, maybe rocking the hips side to side. Really nice. Good. Gently pressing back into your hands. Let's come all the way up to a standing position, working a little bit more on the sides of our body. So coming to a stand, we're going to take, I'm going to move my blanket out of the way here. We're going to take a nice wide stance, bring the heels in and the toes out, bending into the knees. Good. And then cactusing the arms. So elbows bend. You can also have the hands behind the head. I prefer more of like cactus in the arms, elbows bent, arms at a 90-degree angle. Taking an inhale here. Exhale, tipping to one side. Inhale, center. Exhale, tip. Inhale, center. You get some work into the legs here. Exhale, tip. Inhale, center. Exhale, tip. Good. Again, inhale, center. And tip. And again, inhale, center. And tip. Good. Inhale, center. Straighten the legs, release the arms down. Really nice. Stepping the feet together. Let's make our way back onto our mat. So coming onto our mat, if you have a pregnancy pillow, go ahead and grab that. I'm going to create my incline here with my blocks and my bolster. And we're going to do some incline bridges, focusing on really, like, kind of like hip thrusts, right? Focusing really on engaging the lower belly. Now, the trick is that we don't want to get our back, which is why we want to be inclined. We want to really focus the movement onto the low belly. So, onto my back. I'm going to press my hips right against the base of my bolster. Again, a pregnancy pillow can work great for something like this. I'm going to allow my head to fall back. And then on the inhale, I'm going to get really big, lifting my hips. Exhale, curling in as I lower my body down. Good. Inhale. Exhale. Inhale. Exhale, curl in. Inhale. Exhale. Last two. Inhale. Exhale. Last one. Inhale. Exhale. Nice job. Carefully press into your hands and then just push yourself up using your hands and then pause here. So again, if you want to recline slightly, you can have your hands back behind you. We're going to do some movement with the legs. Otherwise, you don't have to recline. You can just have your hands behind you and lift your chest. Okay, so totally your choice. Obviously, being on the bolster or being on the pregnancy pillow is going to give you more support and be less challenging. Lifting the body and keeping that neutral spine is going to be more challenging. So pausing here, walking the feet out an inch or so, and then as you inhale, very gently lifting the foot. Exhale, lower. Inhale. Exhale. Inhale. Exhale. Good. Other side. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Really nice. Good. You can use both feet together. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Last two. Inhale. Exhale. Last one. Nice job. Walk your way all the way up, cross the legs, and just go ahead and fold forward, stretching out the lower back and hips. Sometimes that can take on a little bit of pressure here. Good, and then very gently, we're going to come all the way back, reclining on our bolster, or whatever it is that you're using here. Adjust my blocks. Okay. So you're going to extend your right leg forward, thighs are going to be parallel, okay? As you inhale, lower the leg this time. Exhale, lift. Inhale, lower. Exhale, lift. Inhale, lower. And lift. Last two. Last one. Really nice. Bend the knee, lower the foot down. Pause here. You can take some breaths to stretch out the belly. And then we'll move into the other side, extending the left leg long. Try and keep the thighs parallel and meeting them there as you lift the leg, okay? Inhale, lower. Exhale, lift. Inhale, lower. Exhale, lift. Inhale, lower. Exhale, lift. 2 more. Inhale. Exhale. Last one. Good job. Rebend the knee, plant the feet down. Good. Separate the feet. Give them a little shake out from side to side, dropping the knees right to left. Kind of feels good on the hips and hip flexors. Really nice. When you're ready, you can either use your hands to carefully press yourself up or roll to one side and then press yourself up once again. Good. So those are some key exercises you can do to keep your core really strong, to help stabilize your back. And then, of course, using a lot of that core stability as we go through some of the practices on our mat. So there's always that component that we integrate, but I just wanted to create a little practice that solely focuses on things you can pull into your everyday life to help develop a little more strength here and keep that relationship with the abdominals.